Good afternoon and welcome to the fourth installment of the Nurse Staffing Task Force Project ECHO series. Session 4 is titled Maximizing Nursing Efficiency, the Future of Regulatory Innovation, and will be presented to you by Michelle Buck and Zena Goncharo, with conversations moderated by Brian Sims. Just a few reminders before we start. Please keep your microphones muted to avoid distractions and background noise. You can utilize the chat functions to ask questions during the presentation and the interactive Q&A. If you have any technical difficulties, please tag @ANAadmin for assistance. Lastly, we encourage your participation to make this an engaging session. Throughout the series, we have heard from members of the Nurse Staffing Task Force as they shared recommendations and actions to tackle the nurse staffing crisis. I will be your host for the series. My name is Nicole Anselm, and I am a Senior Policy Advisor within nursing programs at the American Nurses Association. This is a 5-part interactive series featuring content developed and presented by members of the task force. Our goal is to engage nurses in discussions around actionable steps towards tackling the nurse staffing crisis. You will earn 1.5 CNE credits for today's session. To briefly review what we learned in our first session, the think tank recommendations were published in April 2022. The task force recommendations were published a year later in May 2023. The think tank recommendations focus on organizational changes that affect nursing practice. This includes recommendations on work schedule flexibility, the stress injury continuum, and total compensation for nurses. The task force recommendations are focused more on policy impacting the nursing profession. These recommendations center around staffing standards, regulatory efficiency, and the value of nursing. However, the two documents are similar in that they both address recommendations concerning the healthy work environment, innovative care delivery models, and diversity, equity, and inclusion. Last week, Dr. Boston Leary and Dr. Henry discussed how innovations in care delivery models can be leveraged in tackling the nurse staffing crisis. Today, Michelle Buck and Zena Goncharo will share information on federal and state regulatory processes, the need for efficiency, and their role in addressing the staffing crisis. This aligns with the next imperative of the Nurse Staffing Task Force: improve regulatory efficiency. After their presentation, Brian Sims will moderate a conversation between our presenters. During this time, you can add questions to the chat to participate in the conversation as well. Michelle Buck is a Senior Policy Advisor at the National Council of State Boards of Nursing. She has been a registered nurse for over 30 years and practiced as a clinical nurse specialist in orthopedics for most of her career and taught at Northern Illinois University School of Nursing. She served as the clinical nurse specialist representative on the inaugural Illinois Advanced Practice Nursing Board. She has published and presented on several topics related to clinical practice, policy, and nursing regulation. Zena Goncharo serves as a senior policy advisor on the Policy and Government Affairs team at the American Nurses Association, elevating the nursing profession through federal regulatory advocacy. Prior to joining the ANA, Zena was a senior policy analyst for America's Essential Hospitals, playing an integral role in their policy initiatives to protect hospitals that serve a safety net role in their respective communities. In addition to her role at the ANA, Zena volunteers in her community, holding several leadership positions, including president of the Western State Hospital Advisory Council. Zena holds a master's degree in public policy and a bachelor's degree in government and international affairs, both from George Mason University. With over 16 years of experience in working in Maryland's healthcare industry, Brian Sims is the Vice President of Quality and Equity for the Maryland Hospital Association, where he leads efforts to advance health equity throughout the hospital field, as well as advocacy efforts for the Maryland Hospital Quality Program. Brian and his team work in partnership with legislators, regulatory agencies, hospital leadership, and various stakeholders to understand key issues and develop appropriate strategies to advance quality and equity priorities. Brian has also worked with health system finance leaders on finance and reimbursement advocacy and strategy. Brian served as the co-chair for the National Nurse Staffing Task Force and is the president of the Maryland chapter of the Healthcare Financial Management Association. He is also an adjunct faculty member at Boise State University in the graduate level Population and Health System Management program. Now I will turn it over to our moderator, Brian Sims.
Thank you, Nicole, and good afternoon, all of you. It is a pleasure to be here with you today to talk about some of the work of the task force, the National Nurse Staffing Task Force. Again, we've identified this issue as a crisis nationally, and as the list of imperatives that the group settled on signify, this issue is not going to be solved through actions of any one of these imperatives, but really in concert with one another. And so, I don't want to talk too much about the background of the think tank and the task force, because I know Sarah did quite a bit of that in the first session. And a lot of that information is available online. But as Sarah mentioned, today we're going to be talking about improving regulatory efficiency. And obviously there's a lot that can go into that. But the recommendations and the action steps and the imperatives from the task force, they were not necessarily reached through full consensus. It was more of a what is the general direction of the discussions that we've had? And the question that we ultimately asked the group was, what can we live with versus what can we live without? So your participation in our conversation today and our breakout sessions later on is going to be really important to really developing some ideas that you all can take back to your organizations and to your fields to talk about, some of the things that can help solve this issue. And so, again, all of the imperatives that are going to be discussed over these 5 sessions are not intended to be considered in a vacuum, but instead they are intended to offer a selection of strategies that in concert can move towards a more comprehensive approach to address the nurse staffing and workforce crisis. So today, I'm proud to have Zena and Michelle talk about, state regulation, nursing regulation and advocacy at the state level, but then also at the federal level. What are some of the regulatory and legislative advocacy efforts that are going on? What are some of the things to consider as we work to address this imperative? And, out of this conversation today, some of the things that we want to discuss, some of the objectives that we want to address are really discussing the process of regulating nursing practice. What's behind that? What are some of the things that are going on in this space? And to identify resources for learning how state boards carry out their mission. And really, what are some of the things that we can put in front of some of those decision makers, those policy makers, those legislators, and how can nurses in this work and other partners and advocates really work to advocate for legislative and regulatory support around maximizing regulatory efficiency. And then lastly, to help promote increased autonomy for state boards of nursing to study and evaluate licensure activities. How do we make it more efficient? What things are value added? What things are not? And so these are some of the things that we want to get out of today. I don't have to give this reminder, but because there's a lot of activity in the chat already, but I will invite you all to ask questions in the chat. We will try to keep up with those. After the presentations, we will have a moderated discussion, myself and the 2 presenters. And especially during that time, I would invite you all to ask questions in the chat. We will work those into the conversation. And really, this is intended to be an interactive opportunity. Again, after the presentations, we're going to have a moderated discussion. And then we're going to go into breakout sessions where you all will have an opportunity really to lead the discussion. And we will talk more about what those discussion questions will be later on. So with that, I will turn it over to my colleague, Zena. Is it Zena or Michelle? I think it's Zena, Federal. Yep.
It's me. It's Zena. Thank you, Brian. Hello, everyone. So I am going to touch upon the federal advocacy aspect of today's session. As noted earlier in the introduction, I am one of the senior policy advisors on ANA's government and policy and government affairs team. And our team primarily focuses on federal advocacy, that is legislative advocacy with Congress, which I will touch upon in a few minutes, and then regulatory advocacy, which is with the federal agencies, and that is what I primarily do at ANA. So we'll talk about that one first. So our federal advocacy, regulatory advocacy efforts primarily are focused on the U.S. Department of Health and Human Services and all of the sub-agencies. So the Centers for Medicare and Medicaid Services being number one. We engage with the agencies through the comment letter process when proposed regulations are issued, through different stakeholder meetings, and getting in the door ourselves and having one-on-one meetings with the policymakers within the federal agencies. Now, I can't talk about federal regulatory advocacy right now without mentioning the recently issued nursing home staffing rule. CMS, the Centers for Medicare and Medicaid Services, issued this rule on September 1st, and this was long awaited, which would establish federal staffing standards or ratios in long-term care facilities across the country. The proposed rule right now, as it is written, would primarily focuses on a hours per resident per day number for registered nurses and for nurse aides. CMS outlines an entire implementation timeline, enforcement actions, how facilities can get exemptions, and different ways that they would continue to monitor these standards now and going forward. In addition, we also see in this rule, CMS propose a 24/7 RN requirement at all long-term care facilities, which ANA is very happy to see because we have long advocated for that inclusion. So this is a very big rule, obviously, and impacts staffing and really sets a marker in the sand for a federal agency to put in such hard and fast numbers for nurse staffing in a facility that is subject to federal regulations. So we are in the comment process right now. And what that means is that we are closely analyzing all of the provisions of the rule and writing detailed comment letter to the agency, saying what we support, what we think that they could do better, and other aspects for them to consider as they go through rulemaking. All of the comment letters that CMS receives have to be reviewed before the final rule is issued, and they're actually reflected in the final rule. So not only are we writing our own letter and going to be submitting before the November 6th deadline, but we were also going to be working with our members with template comments and other resources to encourage everyone to submit their own comments on this very important rule. So in addition to the regulatory advocacy, as I noted earlier, there's also the legislative advocacy. And with that is primarily focused on Congress and the legislation that is coming from Congress. We have a number of congressional priorities at ANA right now, and they run the gamut from nurse staffing to workplace violence, telehealth, a scope of practice issues, opioid epidemic, and anything else that really rises to the top for nurses and the nursing profession. And so our lobbyists are constantly monitoring to see what congressional priorities are and what we can do to advocate for nurses and match those priorities and push our own as well, especially through Hill and lobby days. As you see, there's a photo there of one of our nurses at one of our recent Hill lobby days, urging Congress to protect nurses. So not only do we encourage our members to come and join us for those Hill and lobby days, but then also interact with us through the political action committee that ANA has set up that allows us to advocate and build relationships with members of Congress through different donations and other resources and support. Obviously, I'm sure as everyone has known, Congress is not always the most efficient body. And so congressional priorities are constantly changing, which makes it makes our lobbyists very busy, but we continue to work closely with all of them to try to align our priorities with what Congress is doing, as well as integrating any of the issues that touch upon not only the regulatory side, but also the legislative side, to try to push through the areas of great importance for our members and for the nursing profession in general. I know we're going to talk about a little bit more, but at this point, I'm going to turn it over to Michelle, who's then going to talk about the state side of things.
So thank you very much, Nicole and Brian, for inviting me to join in the ECHO series. I'm really honored to be here. Thanks, Zena, for the great information about federal regulation. And as you said, we're going to switch gears a little bit and talk about state level regulation for a few minutes. I did want to just give a little background. National Council of State Boards of Nursing, or NCSBN, is a nonprofit organization, and our members are all the boards of nursing from every U.S. state, territory, and the District of Columbia, with the purpose of working together for public protection. So NCSBN, a lot of you know us from the NCLEX, but we're much more than that. We work with nursing education programs. We perform research on topics which impact public protection and nursing regulation in particular. We provide education for regulators or even people that are just interested in nursing regulation. And then a big part of my job is working kind of like Zena on the policy and advocacy side. And we have a variety of initiatives which impact nursing. In my role, I'm particularly engaged with APRNs. But I did want to say right off the top, please check out our website, ncsbn.org. There are an enormous amount of terrific resources there for you in anything related to boards of nursing or nursing regulation on the state level. So let's get started. So I wanted to talk a little bit about nursing regulatory bodies, also known as boards of nursing. And I would guess most nurses don't think about boards of nursing much in the course of your professional life, other than at licensure renewal time. But each of you is in a partnership with nursing regulators through a shared commitment to keeping your patients safe. Boards of nursing are responsible for maintaining the balance between the rights of the nurse to practice nursing and the responsibility to protect the public health, safety, and welfare of all the citizens of that jurisdiction. So the mission of the Board of Nursing is always to protect the public and act as its advocate by effectively regulating the practice of nursing. The board is guided by state law, which is most commonly known as the Nurse Practice Act. And attached to each Nurse Practice Act are rules and regulations that provide guidance on how the Nurse Practice Act is to be implemented. In addition, there are board-related policies and professional standards that all are under consideration by the Board of Nursing. So, for your information, the Nurse Practice Act and regulations, board policies are almost always found on the Board of Nursing website in your jurisdiction. So I would encourage you to go check those out. The guidelines within these regulatory documents that I've mentioned provide the framework for safe, competent nursing practice. Nursing is regulated because it is one of the health professions that poses a risk to the public if practiced by someone who is unsafe, unprepared, or incompetent. A license is issued by a state entity, and in this case, the Board of Nursing, which provides assurance to the public that the nurse has met predetermined standards if they are licensed. The Nurse Practice Act in each state grants authority to regulate the practice of nursing and enforcement of law to the administrative agency within the state, which is most commonly the Board of Nursing. The makeup, membership, and qualifications of the board, terms of office, meetings, election of officers, all that is specified in the Nurse Practice Act in each state. The board is usually comprised of some combination of registered nurses, LPNs, and vocational nurses, APRNs, and often public members are represented on the Board of Nursing as well. But how the membership is constituted depends on the Nurse Practice Act. It's usually defined very clearly. And in many states, board members are actually appointed by the governor. In addition to regulating nursing practice through granting and renewing licenses and its disciplinary obligation, boards of nursing regulate nursing education programs for RNs and LPNs, and in about half of the states, they regulate APRN education programs. Some are authorized to issue advisory or policy statements on a wide range of topics. These are almost always found on their website. It's usually scope of practice or nursing care related topics. One of the hot topics now are IV hydration clinics. So a growing number of boards of nursing have been putting forth position statements on this kind of new growing business model in which nurses are participating in larger numbers. So in addition to the suggestions that Zena shared and the things she kind of talked about and the work that they're doing, I wanted to talk a little bit about state level nursing advocacy opportunities for each of you. And it's really, we're talking about nurse staffing here today, but many of these ideas and opportunities could be applied to any nursing topic or really any bill of interest or legislation that you want to influence as a nurse with any type of policymaker. So in my opinion, one of the biggest benefits of state level advocacy is greater access to your legislator. They live close by. They usually have an office in the district. Might not be in your town, but it would be in another town close by within the district. You may have a personal connection with your legislator. Maybe your kids go to the same school. Maybe your families attend the same church. So that provides a greater opportunity and greater access. But one of the most powerful influences that I've personally experienced for nursing in particular is employment by a local healthcare entity. Because often the lawmaker, their family, their colleagues, neighbors, they've gotten care from a great nurse. And a great local nurse, which is really fantastic. And I just wonder how many of you on this meeting have experienced the old, my mom, wife, brother is a nurse. A lot of lawmakers have a personal experience with a nurse that is important for us to keep in mind. So legislators know about nurses. They know nurses personally, but they need to know you and your stories. What does healthcare look like in your district? Maybe they don't know. Why is what you do so important? Offer them, this is going to sound crazy, but I've heard from nurses who have done this. Offer them the opportunity to shadow you just for a few hours. They'll be stunned at how hard nurses work and what really is involved in the care that you provide. The feedback I've heard from nurses is it's had an incredibly enormous impact on a lawmaker, which makes sense, doesn't it? Walk a few hours in your shoes. Establishing a relationship does not have to be anything formal. It can be something as simple as an electronic email. Send an email to the office congratulating the lawmaker on their election and offer to be a resource for questions related to nursing. The key here is, remember, you don't have to be an expert on everything in the nursing world. You just need to know your resources. And just remember, most lawmakers aren't nurses, so you already know way more about the profession than they do. They may never, ever reach out to you for guidance, but sometime down the road, when you have an initiative or a piece of legislation that you want them to support or oppose, you call the office and say, this is my position and I'd like the representative or senator to know. Their staff tracks every communication that they get, and they will be able to see that 2 years before you had reached out and offered to provide assistance to the legislator. That's important when you circle back and you want something from them later on down the road. We all know there's power in numbers, and that nurses certainly have the numbers. Nurses make up an enormous proportion of the voting blocks in each state, but personally, I don't think it's enough to have lots of voting nurses. Nurses need to know the issues that impact our practice. And membership in a state-based nursing organization of your choice can provide a window into state legislative efforts and information on what members of that group can do to affect change. Often I hear from nurses in my whole nursing career, nurses will say it's too expensive to join the nursing organization, and they use that as a reason not to join. And I wouldn't want to minimize the importance of, that people have to spend what they can. But how else does a nurse stay connected when decisions are being made about our practice? In some states, boards of nursing are allowed to be actively engaged in the legislative process. And if you want to get more involved and have an impact on state legislation, and even just impact on how nurses are regulated in your state, consider taking a position or applying for a position on the Board of Nursing. I was on the Illinois APRN Board of Nursing, which existed for just a short time. I was on the board for 6 years, and it was one of the neatest experiences I ever had. So I can highly recommend it. It's really a neat experience, and you really do have your finger on the pulse of what's going on in nursing in your state. I added the APRN Full Practice Authority onto the list because it's a big chunk of my work. And one of the recommendations of the task force is to advocate for nurses to practice at the top of their license and education. And this is just one of the ongoing legislative efforts in many states. So these are just a few ideas about state nursing advocacy. It could be an hour-long presentation on its own, but your nurses, you're highly respected in your communities. Use that position to connect with your legislators. And just remember, they're just your neighbors. So thanks, and I'm going to pass it back to Brian now.
Thank you, Michelle and Zena. And you know, as someone who advocates in front of legislators and regulators and all of that, I think I even learned quite a bit from the conversation the presentations that you all just had. So let's dive a little bit deeper into some of the things that you all talked about. But I do want to give a shout out to Christine in the chat for offering the one comment, at least that I've seen, that can save you all some money. So Michelle mentioned joining nursing associations. And so Nursing Week is an opportunity to do that, sounds like, for a discount. So thank you, Christine, for that. And so there are several questions in the chat that we will get to those as well. But I want to go back to actually, I mean, Zena and Michelle both said quite a bit, but Zena, you talked about educating legislators. Both of you and Michelle talked about educating legislators and some of those folks, and you talked about helping educate the healthcare community around some of the issues around nurse staffing and some of those things. And Michelle, you talked about the governors are the ones that often appoint staff on some of these boards and things like that. Who are some maybe non-traditional stakeholders that are worth having a conversation with? So, obviously you think about, specific legislators or regulators, but what are some other industries or individuals, chief of staff of the governor's office, who are some folks that can have some influence on this? Because, what I want the group to be thinking about is not only some of the steps and opportunities for action that we're going to discuss, but also who are some of the people that they can help to influence, and maybe what are some non-traditional paths that folks can take. Zena or Michelle, either of you can kind of take that one.
I can jump in, Zena. I would say you ask a really good question, Brian. I'm not sure if that came from the chat or if that just came from you, but I would say what I've seen to be most effective in states when we're trying to pass nursing legislation has been the work of cooperative efforts across a variety of stakeholders. Groups like Chamber of Commerce, groups like large employers of nurses. In the APRN space, we collaborate often with Amazon. We collaborate with large health entities in certain states that employ a lot of APRNs. So it really is important to think outside the box in terms of establishing these coalitions that can all come together in support of promoting nursing legislation and moving policy forward.
And I will jump into coalition work is really critical, and I didn't touch upon it just out of time. I think everyone on the policy and government relations team is involved in some coalition or another. And sometimes the stakeholders are very strange bedfellows, but at the end of the day, if you're trying to move a piece of legislation or regulation or whatever, and you're wanting to amplify your voice, those strange bedfellows sometimes are extremely critical to be able to do so.
Zaina, thank you for that. And I'm gonna lay you up for this next question. Zaina, so you talked about opportunities for engaging legislators. You talked about, maybe on the Hill Day and things like that. Um, you know, so you talked about the opportunities to do that, but what does that engagement look like? So for instance, we just talked about strange bedfellows. We talked about coalitions. A lot of the times when you bring an issue to a legislator or somebody who has some power to influence a decision, they'll say, have you talked to such and such yet? Have you talked to, what does this group think about that? So can you talk, a little bit more about not just the opportunities to engage, but what does that look like? What does it feel like? What are some of the ways, what are some of the things that people need to prepare for in preparation for those conversations, and what does that look like?
Sure. So I think a lot of it is just having constant conversations. You're constantly communicating with the Hill offices to see where they're standing and trying to educate them, because Michelle said it right. Like, we are the experts. They are not. They are miles and miles wide and only, a centimeter deep on most of the issues that are coming in front of them. Whereas we are the experts on our issues and trying to educate as much as possible. But at the same time, you are constantly having conversations with coalitions, with other nursing groups to see, are we all in agreement on this issue that has popped up in maternal health care, or the staffing rule? Like, where is everyone in the landscape? So when we are up on the Hill and they say, well, what do the nurse midwives think about that? We already know, and we can say, yeah, well, we agree, and we're echoing each other, and we think that this is important, and you guys need to work on this with us to push it through.
Yeah. Okay, Michelle.
I can chime in, and I want to comment on Brian, the point you made about lawmakers saying, oh, you're a nurse. What do the docs think about that? Or what does this other group think about your position? And just the one piece of advice I would give is be professional. It's not personal, it's professional. So whatever comment you make in response to that question, have it practiced, have it scripted, that you have a professional and appropriate response. That's my one piece of global advice when that type of thing comes up. And it does, because the lawmakers are not experts, and they're getting insights and comments from a variety of places, and they're trying to sift through their own position based on that information. So the onus is on you to provide the information that you have, and to always maintain your professionalism. I will say, as far as how that relationship works, honestly, personally, I think nurses are incredibly well prepared to have these collaborative relationships, because we collaborate on almost every professional experience and interaction we have. We collaborate with patients and colleagues and the administration and patients' families. And so this is something that we do. It's inherent in nursing. So my advice is just think like a nurse. Think about your relationship just as you would as a nurse. If there's an issue you want addressed, honestly, and I've told this to legislators, when Lauren Underwood was elected, I was so thrilled, and I reached out to her and I said, if you're stuck, just use the nursing process. And I think it's true here too. You identify the problem, you collect your data, your intervention is interacting with a lawmaker maybe, and then you assess the impact of your intervention. And you may need to repeat the process many times over many years to get a successful outcome. That's not uncommon. But when thinking about this question that Brian raised in terms of advocacy about nurse staffing, I think that collaboration should have basically 4 elements. I think it has to be respectful. You can't show up at a legislator's office and expect them to drop everything and talk with you. That's not a respectful relationship. So you call, you make an appointment. When you go, you're prepared. Be prepared if they say, oh, well, the representative is out now, you're going to meet with a staff member. Great, perfect. Thank you so much for giving me that time. Be succinct, share the information that you have, and be prepared to leave something behind. Nothing more than 1 page. So that's really important. And I would say, be concise and succinct so that you are impactful in what you're saying. Think about the most efficient patient handoff you've ever experienced. You are just going to share what needs to be shared to keep the patient safe and allow for an efficient transfer of care. Be responsive. This is huge. When you communicate with the legislator and they say, they ask you a question and you don't have the answer to it, it's okay to say, just as a nurse, I don't know the answer, but I'm going to find out and I'll get back with you.
Mhm.
Then do it. Get back with them in a timely manner. Okay, that's important. And then be available. Let them know you're a nursing resource for them. They can reach out to you. And if you don't know the answer, you will find it for them. So I'm sorry I rambled a little bit, but I feel really passionate about this because I think nurses are incredibly, incredibly influential.
They absolutely are. And I will say, this kind of leads me to another question. So I'm kind of developing these questions as we go along because, Zena, you and Michelle are offering some really good insights. But, so Michelle, you just laid out kind of a blueprint for that engagement, right? And Zena, one of the things in your slides around the nursing home staffing rule, for instance, says long awaited rule. So can you all kind of set the stage for how you manage expectations for how long the process is for doing all of these things and actually seeing some progress? And just say a little bit, and I know we can go down a rabbit hole with this, so let's try to keep it, at the top on the surface, but just say a little bit about what that process looks like, why the timeline often is what it is, whether it's getting a sponsor for a bill or, can you all just talk a little bit about that? Michelle, you're going to have to kind of do those steps year after year in some instances, but can you all talk a little bit about that to help set the expectations for folks here on the call?
Sure, I'm happy to start on the federal level where, as I think I may have already used the word, a little dysfunctional at times, and things are slow and which is unfortunate. And it's slow on the regulatory side and it's slow on the legislative side. There are certain things that have to happen every single year on the regulatory side. So that those include like the Medicare payment rules, Medicare issues regulations for payments for services in different facilities, and then also for physician payments. Those come out at the same time every single year, and we can count on them. And that goes through regular process. The nursing home staffing rule came out of a President Biden executive order at the beginning of February of 2022, who said in spring of 2023, we will have regulations regarding nursing home staffing. Well, this rule came out in September, which I feel like is not spring. So it's still a lot faster than we all thought would actually happen, but it is a little slow. And on the Hill, it all depends, trying to get us sponsors, and trying to compete with everything, especially now that Congress continues to have this habit of throwing everything into a really large bill and one vehicle that kind of moves towards the end of the fiscal year or a continuing resolution. And these kind of must pass bills where you're trying to cram as many things in. It's a little bit harder than regular order where like bills would naturally come through the appropriations process and you can, have a discussion and attach things. And now it's like these massive omnibuses and continuing resolutions that kind of get like figured out at the 11th hour, and maybe everything makes it and maybe it doesn't. It's much harder, and then you try again next time if it doesn't. So let Michelle add to that.
I would say start off with one word, ditto on the state level. It's a lot of the same barriers and challenges exist. I think one of the things is just to always keep in mind, and something that was startling when I was a young nurse and just starting to get involved in the legislative process and regulatory process, is that there are an incredible amount of influences. You might feel like you wrote the best nursing bill in the world, and it's just perfect, and it really meets the needs of nurses and patients in your jurisdiction. But then other people sit down and start to add to it or revise it and edit it, and ultimately, it might not look anything like the beautiful bill that you started with. So a lot of times it's a long game. You might introduce a bill and your goal for that year is to get 20 more sponsors or get 10 more people in the coalition, and you're building for the next session. So I would say don't get discouraged. Sometimes it's the long game. Sometimes it's incremental progress. You don't get everything you ask for, but a piece. And then, I'm going to circle back in 2 years and we're going to go for those next 2 pieces. So, I don't know that there's anything magical because it's all human beings involved in the process with different goals and expectations.
Thank you both. I am looking at the chat. So one of the things I saw in the chat was about, and I forget who said it, I wanted to give credit to the person, but about, state hospital associations can support, what was it? State hospital associations can basically participate in advocacy on behalf of nurses and the issues that surround them. And I can tell you that's part of how I came to this work. Also, I work for the Maryland Hospital Association, and we are very engaged with our nurse partners. I mean, obviously, nurses are a major player in the healthcare field in general. So, as a hospital association, is a lot of alignment there. And we, the Maryland Hospital Association, over the past couple of years, engaged in a workforce kind of environmental scan and report that comes out with recommendations to address regulatory efficiencies. What are some of the barriers that we can remove to increase the pipeline and the support of nurses throughout the field? And so, one of the other questions I think from Catherine was about how to get involved in helping to write letters and or comments. And I'm going to give Zena and Michelle just, maybe add a couple more points about how to do that. But I will say, someone mentioned earlier, coalitions are really important. So Catherine, that is one way to get involved in those opportunities. But first of all, you got to know, what is going on out there. What are some of the ways, Zena and Michelle, that folks can keep abreast of the issues and the topics? Every state, legislative session is different. Obviously, the federal legislative session is it's written into law, so when that is. But every state is different. But what are some of the ways that folks can be aware of some of the things that are happening, and then also to participate in those outside of what we already talked about is participating in a coalition? What are some of the ways that folks can understand what's out there, and then how to get involved in some of the comment letter writing?
Ina, do you want to start?
I'm happy to start. Yes. So we try to push out information as much as possible we can to our members through different avenues, including posting on our website and under the advocacy section when we do see things coming out of the federal agencies in particular, on different opportunities to comment, different proposed regulations that are being released, etc., as well as through our communications with our state constituent groups. So that is one way to continue to monitor, and we hope that everyone is constantly just pushing that information out. We are constantly looking to refine that as well. The comment letter writing process on federal regulations is a completely public process. Anyone can do it. Our letters are very long, but I have seen folks who, through the portal that the Federal Register has created, the regulations.gov has created, people have just submitted like a line or two with their name and their background, and that's it. So the process is open, and anyone who's interested can participate in that process.
I would say on the state level, I would go back to what I said earlier. I think participation, and Zena's, reinforcing this, participation and membership in a state-based nursing organization. That is incredibly important and valuable on staying abreast of what's going on. The other thing is reaching out to your legislator. A lot of their websites are very good. They will talk about bills. Mostly they focus on the bills that they are sponsors or co-sponsors of, but that is just another place that you can look. If you're a member of a state organization, or for example, NCSBN, our websites on our initiatives include a lot of ways that will facilitate your ability to communicate with the legislator on a particular topic. So there are a number of interventions that can be placed on a website. One, for example, is Voter Voice. And Voter Voice is essentially a templated letter that is still customizable. So you could say, hey, Representative Jones, I'm your neighbor. Remember we met at the block party, and I'm a nurse also, and and then you could use the templated language. So there are tons of resources to be utilized to make that process easier for you.
Thanks. So we have a lot of comments or questions, it just went away, about the ANA stance on nurse staffing and some of the staffing standards. Zena, maybe say, so for the group, the 5th session, so on October 19th, that entire session is going to be about achieving excellence in healthcare and nurse staffing standards. So we're going to go into much more detail about the state of play there in a couple of weeks. So Zena, maybe you could say a little bit about that. ANA stands on. I don't know if you can today, but also maybe focus a little bit. So say what is meaningful right now, but also Zena, can you talk about whatever ANA's stance is? Can you talk about what that process looked like and what that looks like going forward? Again, today, because we're talking about engaging with regulators and legislators, maybe talk about what that process looked like to develop a stance or a position. And so maybe we can tie it to today's session. But for the group, we will get into much more detail on that on the 19th. But Zena, you want to say a few words?
Yeah, sure. So ANA is supportive of the CMS's proposed rule on the nursing home staffing standards because we strongly believe that safe staffing standards are just one approach to all kinds of different of all of the different approaches to address the workforce challenges that nurses face. We are still in the process of gathering information and analyzing and writing our comments, which will be made public to everyone once we submit them before November 6th or on November 6th. From there, we have, in terms of getting to the point where we are now of kind of pen to paper, a lot of this has been an ongoing conversation that we've had with our members and just trying to gather the perspective and try to really understand what's going on on the ground and how that relates to what CMS is proposing. And we do that with every single regulation that comes across our desk, because that is the best way for us to be able to communicate with CMS or whatever federal agency we're writing comments to ensure that the voice and the nursing perspective is being shared through that. Before, a lot of times, especially when it's a special kind of a rule like this one, CMS actually issued a request for information in the skilled nursing facility payment rule last year. And so they already started gathering information. And so that was like one ability to have a bite at the apple. Then you can have meetings before rulemaking even starts, which is another way to have another bite at the apple when you're talking to regulators. As well as soon as it's a little harder, because once they're in rulemaking process, they'll meet with you, but they can't really share anything with you until the final rule is issued. But you can still have a meeting with them during that process to reiterate your points. And then a lot of times after the fact as well, because just because a regulation has been issued doesn't mean that that's it, and it can't ever be revisited. So I hope that answers the question.
Yeah, no, I think so. I think the process is really important. And I think like we said in the chat, we're going to get more into detail about it later. Can you, Zena and Michelle, as we start to wrap up this portion of the conversation, and I think, I know for this topic around staffing standards and things like that, both in long-term care facilities, hospitals, and elsewhere, data is a big component of that. How do you tell a story without data? And so, what I want to ask this group, or what I want to ask you all to share with the group are, what are some of the ways that nurse leaders and advocates on behalf of nurse issues can not only amplify workforce data and kind of the impact of the state of the workforce, but how can they access that? And then, what are some of the ways to construct narratives based off of that? So, can you just talk a little bit about how data factors into, how a position is developed or determined, and then how that is communicated to some of those legislators? What are some of the ways to amplify that data?
Sure. So from our perspective, data is really critical, because for us to tell the complete story and picture of what's going on as we're trying to communicate that to either regulators or legislators. The issue that we are constantly looking for new data sources, and we encourage everyone to take any of the surveys that ANA pushes out because we tap into them constantly. Yeah, I'm doing the plug for all of ANA surveys. Please fill them out because they're really, really helpful for us, especially on the policy and government affairs team, when we are trying to tell a story. Because if you say, X number of nurses are leaving the bedside, and that number is really powerful, that like pricks the ears up of especially legislators who love a really good story. And that's a good way to illustrate exactly what's going on and what the issue is and why they need to listen to us, and work with us to address it. So
Yeah.
I think the terminology around these sessions, data to action, that's it. You can collect all the data in the world, you can have the best designed research study ever, but if it's not disseminated, then it's irrelevant. So, and the way it has to be disseminated is multi-pronged, just like with patients. They learn and hear things differently. So you can't just have one approach to put out your data and expect people to understand it. And it has to be repeated over time because the listener might not be in a position that where they appreciate the terminology they're utilizing, or they can integrate the data that you're sharing. So, I have to say, NCSBN this year, as I think you probably all know, we released our 2022 nursing workforce study. And for the first time, the researchers did a press conference at the National Press Club in DC. And many members of the press were there. And the workforce study results were covered in the public press, in newspapers, online, on national news broadcasts, state level news broadcasts. It was very, very effective. The research team was receiving requests for interviews for months afterwards from really like high-powered news sources. And with the multi-prongs idea in mind, all the data were also published in the Journal of Nursing Regulation so that professionals would have access to it as well. So I just think data is only data without the action.
Thank you, Michelle. I think you have led us into kind of like our final question. Mary Grant, I see you have your hand raised. I don't know if we're taking live questions. If it's something you can put in the chat, I'd be glad to ask it. But there are 300 people here. But also, I do invite you to participate in the discussion, the breakouts shortly. But if you can put it in the chat, I'd be glad to answer it. Does that work, Mary? Okay, thank you. So Michelle, you just talked about data and action, right? So while we wait for Mary's question, Michelle and Zena, can you all, as we wrap this portion of the afternoon up, maybe share like one or two like calls to action? What are some of the first steps that folks can walk away from this conversation and do and engage in or take back to their teams? Listen, there's no shortage of hot button topics, particularly around workforce, particularly around nursing right now. What are some immediate steps or action steps that folks can take as they walk away from today's conversation?
Dina, do you want to
You want
start?
to go first? I was going to say I would strongly encourage everyone to interact well and participate and focus on all of the stuff that your association, either state or federal national level association, is doing, because I think everyone is constantly trying to push out that information and filtering it and flagging ways to get involved and make sure that the voices are heard, be it through submitting comments that echo a certain position or filling out a survey to provide some data. I know that we've also gone through, especially during COVID, asking people to share their stories with us so that we can go and tell an actual story of a nurse at the bedside. All of that is extremely helpful to get involved and for us to continue just to be better advocates at the federal level.
I would agree with everything Zena said. And then I would add, to me, it's almost like there's a need for a culture shift, that nurses need to make room for advocacy in how they identify themselves as professionals. to me, I feel it's a professional obligation to advocate for your profession. And in whatever way you're able to do that, in whatever time you have, I think that's important. And nurses, by sheer numbers, have enormous power if we all come together and advocate for our profession.
Thank you. So Mary's question is a great one. We're gonna I'm just looking at the chat. So Mary asked how to make the financial link of nursing positions to the overall cost of healthcare. Does it cost money, save money, for whom, and how? That can be a complex question, but I'll answer it simply like this. So on September 21st, we talked about transforming cost into value, recognizing nurses' unique contribution to care. So, what are some of the value-added things that nurses do? What are some of the things that are inefficient, that are not, allowing nurses to practice at the top of scope? And so, we've had a conversation about that. There are some key action steps, Mary, in the task force recommendations around how to do that. But I do think that is a critical piece. And I think, I'll just very briefly, nurse salaries are often just rolled into the overall total cost of care in a hospital in particular. You don't allow, there's no way to really determine, what is the value of that care. And so that's part of the reason that there's this, this conundrum with the finances or the cost of salary, because it's not tied to individual outcomes and things like that. That is something that, we proposed, again, some action items around, but it's a very important thing to consider. I would invite you to look at that recording and maybe some of the items that are in the task force recommendations on that. Michelle or Zena, anything to add to that, to Mary's question?
I would just build on what you've said, Brian, that the task force calls for to consider the utilization of a unique nurse identifier that would allow the nurse to be pulled out, like what Brian's talking about, for the actions and value of the nurse to be specifically identified through that process. So
thank you. Okay, let me see. I think there may have been one other question. So the last question I will ask Zena and Michelle, this is from the chat. Are you all familiar with the National Nurse March, which started in May of 2021? Any thoughts on that? Maybe not. So that'll be a question that you all should discuss in our breakout group. So I'm going to, so in just a moment, let me pull up the questions that we have. So in just a moment, I think we are going, not I think, I know, we're going to be placed in the breakout rooms. We're going to break this big group up into somewhat smaller groups, still will be fairly large. And each group will have a discussion facilitator, and each individuals within that room will have an opportunity to engage in discussion with your peers. Again, this is intended to be very interactive. We will have an opportunity, the guests will have an opportunity to ask questions, offer feedback live. And then when we return, so after about 20-25 minutes or so, we'll share key takeaways from those discussions. Again, this is intended to be interactive. Some of the things that we're going to be discussing in these breakout groups: how does regulation and policy affect the implementation of other imperatives of the task force? So both the work environment, the economic value of nurses, Mary, that is something that we'll be able to discuss there. Care delivery innovation. We talked a little bit about technology earlier and the use of technology in supporting or improving the regulatory efficiency for the practice of nursing. What are some of the delivery innovations that can be considered? Staffing standards, lots of conversation in the chat about that. And then also, what barriers do you foresee in implementing some of the imperatives, again, of the task force, and how do we mitigate those challenges? How do we overcome those, and how do we prepare for those? So as we get ready to go into our breakout groups, those are some of the questions to think about, and we will be able to share those again once we get in the breakouts. I'm going to give some key takeaways. And actually, we can drop the screen. Give some key takeaways, and then so just about a minute or so, and then I'm going to turn it over to group 2, if you know what group you were in, and let that facilitator offer some key takeaways, and then we're going to turn it after every group goes. I think it was 5 groups or so. We're going to turn it back over to Nicole to close this out. So in group 1, we had lots of really good conversation. You heard Chris Marie just now finishing up her thought. Really started from her opening comment was about speaking the language of finance, understanding what those finance leaders and some of the other leaders in the organization, what are some of the ways that they are thinking about the cost of nurse staffing and the salaries and all of that, what is non-productive versus productive time, and just reframing that and just educating them on what is currently considered as non-productive, how that actually is productive, and how that contributes to just the overall goals and operational priorities of the organization. So that's really important. One of the other themes in our group was really about unification across nursing and ensuring that, in the various states where there may be some issues going on, getting the various professional nursing associations and other, nurse advocates kind of on the same page, having a unified voice. I will say that, as someone who advocates in the healthcare space, the number one way to get a policy or a piece of legislation killed or not moved is for folks in the same same position, same space, to be on separate sides of it, because then that wedge can be drawn. So that was one theme. The last theme, it really is kind of related: consistency and having a focused message. As we talked in the presentation and the conversation before the breakouts, some of these things take years to move. You kind of start a process one year and you're going to go through that process again and again and again, and being consistent, having a message that resonates repeatedly, and just it's almost like marketing your issue. So that was another theme that came out of our group. And so with that, I will turn it over to the facilitator for group 2.
I think that was me, Brian. I'm going to entitle my talk "Pearls of Wisdom," because we had some wonderful comments. So I'm just going to kind of share some of the comments that were provided. Ratios are great, but we need to be aware of potential implications, and we also need to be aware of unintended consequences. We need to look at people who are innovators and who are doing, looking for the stars, was the terminology, who are doing a great job in this space, and try to emulate them. And also the value of data around that work and making it available for people to utilize to move things forward. And that legislation is not the only answer. Need more data and share results. Comment was that we try and run healthcare like a factory, but the problem with that is humans are unique and individuals, and so that's what makes ratios hard as a result. In alignment with what Chris Marie was just saying, someone commented about since COVID, the quote-unquote non-productive time of charge nurses has been removed, and so that enormous benefit of them sharing their expertise, resources, and assistance with busy staff nurses has been removed in a lot of places, and that those charge nurses are often the most experienced, and as a result get burned out. Another person said we need to look at the pipeline of where new nurses are coming from, and we know that nurses left the profession as a result of the transition. And the statement was, who's going to be left to meet the ratios, and where do those nurses come from? And then the concept around the influence of insurers, Medicare, Medicaid, and other insurance companies, and that the business model that we currently have applied to healthcare that's been there since the 80s does not work. And we know that. And how do we go forward? And the fact that nurses need to be educated about that and be advocates for change. And that the barrier related to insurance companies deciding how long someone is going to be treated. And if someone exceeds that length of time, they end up in the ED, where they will gladly pay for the care they provide, which is much more expensive. And then the last comment was, we need a shift of mindset if we're going to look at ratios and look really strongly at acuity, as opposed to, and the good matching of patients with staff to move forward. Thanks.
Thank you,
So,
Michelle. Go ahead, Zena.
Sorry, I know I was like group 3, and without repeating much, I just wanted to make note that we did talk a lot about educating, and not only educating stakeholders, but also educating our own nurses all the way down to the bedside. So everyone understands and we're all on the same page, or at least trying to get onto the same page. And then one of the big barriers is trying to balance the other organizations' opinions and perspectives and how that can influence. And I know Brian alluded to that too, as well, of like, if we're on different sides of an issue, that issue is not going to go anywhere. And then acuity was also another thing that we talked about as well. So in the interest of time, I will hand it off to the next group.
And last, we have Sarah Delgado.
Yeah, I was group 4. So we talked about some of the same things. So again, I'll follow Zena's example and not repeat, but we did talk about ratios and unintended consequences of ratios and sort of thinking that through. How does it play out in the practice setting? We also had one participant who asked the question, what other policy options are there? Which I thought was a great question to ask so that we can really start thinking about ways to bring ourselves together as nurses and think about all the different ways in which we might impact staffing levels. We talked about documentation burden and acuity measurement and basing staffing on accurate measurements of the workload of nursing and different ways to do that. And then we also talked about burnout and the relationship between staffing and burnout. And is there a place for policy and regulation that can address that impact of our staffing crisis? So I think that's a pretty good synopsis. If anyone was in my group, I apologize to my group because we ended very suddenly and we didn't have a good wrap up at the end.
It's a good problem to have, Sarah. It means everybody was fully engaged and the conversation was flowing. And I know ours was too. So, well, thank you all facilitators for that. Nicole, we're going to turn to you for wrapping us up.
Thank you, Brian. Thank you all for sharing your discussion takeaways. As we wrap up today's session, there are just a few reminders I would like to share with you before we end for today. Don't forget to complete the evaluation form to claim your CNE credits. You can do so by either scanning the QR code on your screen or following the link that will be placed in the chat. You will earn 1.5 CNE credits for today's session.
I've just had so much bad luck.
I would like to thank our presenters, Michelle Buck and Zena Goncharo, and our moderator, Brian Sims, for today's session. And for our 5th and final session on October 19th, Task Force members Dr. Sherry Perkins, President of Luminous Health Anne Arundel Medical Center, and Dr. Matthew McHugh, Professor and Independence Chair for Nursing at the University of Pennsylvania School of Nursing, will be joined by subject matter expert Dr. Nancy Blake, Chief Nursing Officer at Los Angeles General Medical Center. They will discuss how establishing staffing standards can ensure quality care for patients. Thank you, everyone, for joining us today, and we hope you enjoyed your time with us, and we look forward to having you join us for our final session on October 19th.